Hello, I'm Professor Chen, also called Oscar, and I'm an assistant professor at School of Respiratory Therapy at Taipei Medical University. And previous year, I am a respiratory therapist working at Wanfang Hospital. So today I will talk about the ventilator. Okay. So today I will talk about this specific type of emergency transport ventilator. So the first is a brief overview about this ventilator. And this ventilator can use invasively or non-invasively. And invasive means that the patient use endotracheal tube intubation, or even the patient use tracheostomy tube. And non-invasively means that the patient just use the mask to cover both nose and mouth. And this ventilator can use for patients more than 10 kilograms, so maybe from infant to child to adults. And the ventilators requires to operate within a pressure range. This is oxygen cylinder pressures around 2.7 to 6 bars. But I know in this hospital, our pressure gauge show different units, usually show per square inch, PSI. So when we change the unit, this equal to around 50 PSI. So we need to turn on oxygen cylinder and to let the needle rise to 50 per square inch. And another thing is that this ventilator has battery, and the battery capacity is up to 10 hours. But I need to mention this part is that this battery, it means that the new battery can operate for up to 10 hours. So if you use the ventilator several times and use it and recharge again, the battery capacity could decrease. And next things, I will focus on the hardware and then software of this ventilator. So on the right side of ventilator, when you face the ventilator, the screen of ventilator on your right hand side, they have one small nozzle over here, and this is used to connect a small tube. I will show you later, and to measure the airway pressure around the mouth of patient. And this large bore, this line is used to connect the inspiratory line. And below the inspiratory connection part, this part is safety valve. But this valve is just used for safety. So if the pressure inside the ventilator is too high, this valve will open to release the pressure. And below this ventilator is one of a filter, air filter around it. So because this ventilator just connect the oxygen cylinder, and we know that oxygen cylinder provide 100% of oxygen. So if we would like to decrease FiO₂, fraction of oxygen level, below 100, we require this part to suck in air to do dilution, okay, to dilute and to get the patient FiO₂, or fraction of oxygen, below 100%. So this part is air entrant port, and they have one air filter around it. And on the left-hand side of ventilator, they have this is O2 inlet to connect O2 pipeline and connect with oxygen cylinder. And beside this part is DC interface connect with a charger. And this speaker is for alarming. And on rear side of ventilator, this is a battery part. So if you would like to change the battery, just screw this part and to change the battery over here. And the front side of ventilator, this part is the screen of ventilator, and this part is the alarm, and this one is alarm silence. So when you hear alarm, you can just press this alarm silence key to silence alarm and to do troubleshooting. And below this part, the three knobs is used to adjust ventilator setting. So this one is meaning ventilation, and this one is frequency, means respiratory rate. And this one Pmax means that this is a pressure limit. So means that the pressure delivered from this ventilator should not be higher than this setting, Pmax. And another setting is over here. I will talk about these things later. And one of the important things is this button. This is a switch on and off button over here. Okay, so when you switch on the ventilator, you can see the screen, and the screen will show this part is battery status over here, and this part is mode. And this ventilator just has two modes. One is IPPV, intermittent positive pressure ventilation. The other mode is assistant control, AC mode. And later I will talk about the mode. And the below showing here, it depends on different software version. Some software show the scale like this one, but some software show the waveform. So later I will talk about how to interpret or how to read the waveform. And the below is the parameter, especially pressure. This one, peak inspiratory pressure. Okay, so next I will talk about the step-by-step to use this ventilator. So the step one is to connect the pipeline over here. So connect this pipeline and connect to the oxygen cylinder, and also connect the power cord beside the O2 pipeline. So this is a step one. And step two is to connect the other side. So the other side is breathing circuit. So the blue line showing here is the inspiratory circuit over here, and connect to the this yellow adapter. And this adapter have one-way valve, and they can divert the gas, inhalation gas and exhalation gas. And this one, the small bore connect to the pressure line, and this pressure line also connect to the yellow adapter over here to measure the pressure around the mouth of the patient and show on the screen. And step three is that after connecting oxygen pipeline and oxygen cylinders, the next step is to turn on oxygen cylinder and power cord. And remember to turn on the oxygen cylinder to let the pressure around 50 psi per square inch. And the step four is that after turning on oxygen cylinder, the next step is to turn on this button, switch on button. And step five is to check this one. And this one have two selections. The first one is air mix. The other one is no air mix. And no air mix means that all of the gas are derived from oxygen cylinder. So this is a pure oxygen level, deliver FiO2 around 100%. And air mix means that if you turn to this position, means that FiO2 can be diluted by air. So after dilution, FiO2 from the manufacturer's manual, they say FiO2 should be decreased to 55 to 85%. But I like to point out one thing is that if you use this ventilator at high altitude, because they have a low barometric pressure or a low partial pressure of oxygen at high altitude. So if you use this ventilator at high altitude or in helicopter, if you shift to air mix position, sometimes this FiO2 could be lower than 55%. So this 55 means that just you use the ventilator at sea level only. So because if you turn to this air mix position, sometimes you don't know exact FiO2 delivered to the patient. So that's why I recommend you to shifting the setting to this part, no air mix, to deliver 100% of oxygen. And the step 6 is to adjust mini ventilation setting. So this is a mini ventilator setting adjusting knob over here. And they show different colors. So if you use in adult patient, the body weight more than 60 kilograms, you can adjust to this region, the orange region. And if this is a pediatric patient, you can adjust to the blue region over here. And if this is a neonate to child, you can adjust to this pink region. And step 7 is to adjust frequency or call respiratory rate. So it depends on the color over here. So adult is orange color, pediatric is blue color, and neonate to pediatric is this pink color. So in the manual, they have one scale over here. So you can just follow the scale to adjust the mini ventilation setting or respiratory rate setting according to manufacturer's recommendation. And also you can just print this scale and tap it on the ventilator, and you can directly use the scale to adjust it. Okay, so from the above description, it's talk about a much more easier way to adjust ventilator setting. But if you know the basic concept of ventilator, sometimes we use this one. We do calculation to calculate the tidal volume and calculate the respiratory rate for our initial setting. So for us, we not just look at the scale to do adjustment. Sometimes we do the calculation, okay? But if you feel that the following part is too difficult for you, you can just use the scale to adjust the setting. Okay, so I will talk about how to do calculation to set specific tidal volume to the patient. So for this ventilator, we need to adjust mini ventilation over here, adjust frequency. So they have one equation showing here, show that mini ventilation equal to tidal volume times respiratory rate. So usually we set the initial tidal volume around 6 to 8 ml per kilogram of ideal body weight. And you can search equations online about ideal body weight. There are a lot of equations talk about how to calculate ideal body weight. And I think every equations are similar, so you can use whatever you want. So we calculate the patient's ideal body weight and do initial setting to set tidal volume around 6 to 8 ml per kilogram. And next is to set respiratory rate. Usually we set the normal range of respiratory rate around 12 to 20 breaths per minute. And we commonly use 12, 14, or 16 breaths per minute. So for example, if you have a patient with ideal body weight around 60 kilograms and initial respiratory rate, we like to set 12 breaths per minute, how do you set mini ventilation? So we need to do a little bit calculation over here. So for initial tidal volume, if we like to set 8 ml per kilogram, so times this patient's ideal body weight 60, so we can get the initial tidal volume is 480, or you can just use 500 ml. And respiratory rate, because we like to set 12 breaths per minute, so we calculate mini ventilation over here, so use 0.48, or you directly use 0.5 liter and times the respiratory rate 12 to get the mini ventilation around 5.7, or you can just set 6 liter per minute. Okay, so this is a unit should be, one of the units should be changed is this tidal volume, because we usually use ml in tidal volume, this parameter, but we use liter per minute for mini ventilation. So you need to change the unit from ml to liter first. And so after calculation, we know that we need to set mini ventilation around 6 liters per minute. So just adjust this knob to that the scale over here, 5 to 7, between 5 to 7. So it means that you deliver 6 liters per minute of mini ventilation to the patient. And also adjust the frequency, this knob, to the 12. So it means that you deliver respiratory rate around 12. Okay, and after adjusting mini ventilations and frequency, the next step is to adjust pressure limit Pmax setting. But this setting just for alarm, just for the protections to prevent high airway pressure in the lungs of patients. So usually, if the patient use mask ventilation, use the mask to cover nose and mouth, we need to set the limit around 20. Okay, and if your patient use invasive mechanical ventilation, use endotracheal tube, from the manual they say should be set 45, but in our clinic we usually set this pressure limit around 35 to 40. Okay, and also I saw the people here are slim, so we don't need to use high pressure. We just need to use the 45 to 40, 35 to 40 should be enough for the patient. And step 10 is to connect the patients. So for non-invasive ventilation, an IV will connect this yellow adapter with a bacteria filter and connect to the mask and to cover the nose and mouth of the patient and use strap to fix it. And if the patient uses endotracheal tube, also called ETT, we need to connect this part, yellow adapter, with a bacteria filter and directly connect to the ETT for invasive ventilation. And after connecting the ventilator to the patient, the step 11 is to check airway pressure over here. So we need to check this peak inspiratory pressure, and this pressure should be below 35 to 40. And sometimes if this pressure can be below 30, it's much better. But at least you need to keep this pressure below 35 to 40. Okay, and the next step is to introduce the mode. And in these ventilators, they have two modes, IPPV and AC mode. And so before talking about the mode, I need to focus on this equation. So I use the same example. So if we set mini ventilation around 6 liters per minute, frequency around 12 breaths per minute. So when we do calculation, we can calculate tidal volume around 500 ml. So not just for calculation, we need to interpret this equation. So this equation means that the ventilator delivers constant tidal volume, and this tidal volume is around 500 ml. And how many times the ventilator delivers in 1 second? The ventilator delivers 12 times per minute to get the mini ventilation around 6 liters per minute. But because we have another parameter over here, the pressure limit Pmax, and when we set 40, means that the ventilator delivers constant tidal volume around 500 ml, 12 times per minute to get the mini ventilation around 6 liters per minute, but with the pressure level no more than 40. So it means that the ventilator delivers positive pressure at the tidal volume around 500, but the pressure they deliver is not more than 40. Okay, so from the waveform, we can see that this is a pressure time curve. So x-axis shows the time in second, y-axis shows the pressure level. Okay, so in IPP mode, intermittent positive pressure ventilation, the ventilator delivers for this one green triangle, means that the ventilator already deliver 1 breath, and the ventilator delivers this breath around the tidal volume should be around 500 ml. If we set the mini ventilation around 6 liters per minute, frequency around 12 breaths per minute. So from the scale, we can see that we can see 3 green triangle over here. So it means that the ventilator already delivered 3 breaths. But because we set the frequency, the respiratory rate around 12 breaths per minute, so it means that in 1 minute we can see 12 green triangle over here. And if we add another setting, the pressure limit around 40, means that each triangle, the peak of the triangle should not be more than 40. So the peak of triangle should be, sometimes is variable because it depends on the lung conditions of the patient. But overall, all the peak of the triangle should not be more than 40 if we set this peak max around 40. And this is AC mode, assisted control. So when we like to turn on this mode, we need to press this button, assist this button. So this button is over here. So this button. So when we press it, we can see the screen can show this assisted control. Okay, change from IPPV to assisted control. And this assisted control, most of things of assist control is similar to IPPV. So in assist control, the ventilator can also deliver a tidal breath over here, so we can see the green triangle over here. But one of the things is different is that because we turn on this assist control mode, so the ventilator can sense the patient's trigger. So this part is the patient's trigger. So because if the patient have spontaneous breathing, when the patient trigger a breath, they can have a chest wall movement, and this can cause the decreased pressure in the ventilator circuit. So this ventilator detects the slightly decrease the pressure in ventilator circuit to sense the trigger from the patient. So if the ventilator sense that this patient has trigger, the ventilator will deliver another breath over here. So I use a different color. So this means that when we set the respiratory rate around 12 breaths per minute, the ventilator can deliver 12 green triangle. Okay, so this part is the same as IPPV mode or assist control mode. However, if the patient has spontaneous breathing, for example, if the patient has the respiratory rate around 20, so when you turn on assisted control mode, it means that the ventilator will deliver 12 breaths of green triangle with another 8 breaths of this yellow to orange triangle. Okay, because now this ventilator can sense the trigger from the patients. So this means that in IPPV, if you set the respiratory rate around 12, the ventilator can just deliver 12 green triangle, okay, 12 breaths per minute. But if you set the same respiratory rate in AC mode, and it depends on the respiratory rate from the patient, the ventilator delivers at least 12 breaths per minute. So you can still see the 12 green triangle in 1 minute. But this mode can also sense the trigger from the patient. So if the patient have spontaneous breathing, the respiratory rate more than 12, the ventilator can deliver another breath. Okay, so for example, if the patient have 20 breaths per minute, the ventilator will deliver another 8 breaths by the patient trigger. So the total respiratory rate in 1 minute is about 20, it's not 12. So this 12 is just at least 12 breaths per minute in AC mode. Okay, so the third part is talk about the troubleshooting. So the first thing is stenosis alarm, or we call high pressure alarm. So high pressure alarm means that the pressure, because we already set the Pmax around 40, so it means that if the airway pressure the ventilator measure is more than 40, it will show this stenosis alarm. So when we do the troubleshooting, we need to look at the patient first. So you can use your stethoscope to assess or to check the breathing sound first. And next is to look at the artificial airway, or if the patient use non-invasive ventilation, we need to check the mask. And third is that go further upstream to look at the ventilator circuit to check the circuit. And finally is to look at the ventilator. Sometimes it's device malfunctioning. Okay, so we look at the lung first. So when we hear this stenosis alarm, we need to check the patient first. Okay, so I list some common troubleshooting or common problem associated with a stenosis alarm. So the most common things is secretion. So secretion block or secretion accumulate in the airway of the patient. So maybe when you do oscillations, you can hear the crackle or diminished breathing sounds. So you need to do suction. And another thing is that sometimes you can hear a wheezing sound, or diminish means that this is bronchospasm. So sometimes we need to have drug inhalation, especially bronchodilator inhalation. And the third common thing is cough. If the patient has cough, sometimes because this ventilator is used in transportation, so when you move the patient, sometimes it stimulates cough reflex. So just wait until the patient is stabilized. And the final common things is ventilator asynchrony. So this asynchrony means that if the patient has spontaneous breathing and when the patient wants to exhale, but now at the same time the ventilator delivers and inspire gas, and these two gas, expire gas from the patient, inspire gas from the ventilator, these two gas collide each other. This can also activate stenosis alarm, and this is called ventilator asynchrony. So you can adjust respiratory rate according to patient's respiratory rate, or just turn on assist control mode to let the ventilator sense patient's trigger. And if you don't find any problem in the lungs of patient, next step is to look at upstream, to look at airway or mask. And the common things is the secretion block in the mask. So you need to do suction or secretion block in endotracheal tube. And the second thing is kinking of endotracheal tube. So kinking means that because the material of endotracheal tube usually is PVC, the material is that, and this material can become soft when it contact with the body temperature of the patient. So when you insert endotracheal tube into the patient's airway, sometimes the body temperature can soften this endotracheal tube and cause folded. So this is called kinking. Or the teeth of the patient bited. So you need to repositioning or insert an oral bite block. So in your first aid box, maybe you have oropharyngeal airway or like this oral bite block, and you just put this beside endotracheal tube to prevent the patient's bite the endotracheal tube. And another thing is endotracheal tube migrate distally, means that this is one lung intubation. When you move the patient during transportation, sometimes endotracheal tube insert deeply. So this is called one lung. And you need to check the mark on endotracheal tube and do repositioning. And if you don't find any problem within artificial airway or mask this level, and you go further upstream to look at ventilator circuit. So the common thing is that secretion, water, condensed water, or blood obstruct in the circuit. So you just disconnect it, directly suction the sputum in the ventilator circuit and clear the fluid. And next thing is kinking the tubing. So you need to check the whole tube from the ventilator to the patient, connecting side and repositioning. And finally is malfunction in expiratory valve. So for this ventilator, they have one yellow adapter, and this yellow adapter has one-way valve. So if this one-way valve become obstructed, this can cause stenosis alarm. So you need to change the ventilator circuit or change the yellow adapter. And finally is to look at the ventilator itself. So sometimes it's malfunction in ventilator. So if you face a problem with malfunction in ventilator, or you cannot find any problem, or even you find a problem, maybe malfunction in expiratory valve, but you don't have another backup ventilator circuit. So if you face these problems, you can just disconnect the ventilator and use back valve mask resuscitator. So like this one, this is a manual resuscitator, and you need to remember to connect the oxygen tube beside this bag and connect to the oxygen cylinder. Okay, and another important alarm is disconnection alarm, and usually is due to leakage to cause this disconnection alarm activation. Okay, so the order is the same. So first, check the patient. Always check the patient first. So check the lungs of the patient. But these things, trauma, it rarely happen. Okay, so sometimes the patient has car accident cause trauma, and maybe sometimes they cause, this is called BP fistula, or the patient already has chest tube insertion, cause chest tube leakage, and these things may cause leakage. So sometimes you need to use surgical patch to cover leakage part or reposition the chest tube. And usually you can imagine that if you have an injured site or a hole on the chest wall, and if you deliver positive pressure, sometimes this positive pressure can go out from the hole of the chest wall. So if these things happen, sometimes we decrease our positive pressure setting. So sometimes we decrease mini ventilation setting or our tidal volume setting, okay, to prevent the leakage of positive pressure from the injured side of the chest. But these things rarely happen. And the most common things for disconnection is usually at artificial airway or mask, this size. So usually it's leakage around mask, so you need to repositioning or just add a patch between the face and the mask of the patient to minimize leakage. And another thing is endotracheal tube cuff deflated. So I think you already know that our endotracheal tube have the cuff over here. So sometimes it's deflection of the cuff cause positive pressure leakage. So just use 10 ml of syringe to reinflate the cuff. And the third thing is endotracheal tube migrate proximally. And proximally means that this endotracheal tube moves out. So you need to check the mark and also do repositioning. And the final thing is endotracheal tube cuff rupture. And if you face this problem, you need to change endotracheal tube. And if there's no problem within airway or mask least level, the third thing is to look at ventilator circuit. And the most common things associated with ventilator circuit is disconnection of the tube. So just reconnect it. And sometimes is aspiratory valve rupture, tube or aspiratory valve rupture. The yellow adapter become malfunctioning or become ruptured. So you need to change the ventilator circuit. And finally is to look at, to check the ventilator, the device. And if you find this is a malfunction in ventilator or you cannot find any problem, do the same things. Disconnect the ventilator and use the manual resuscitator to ventilate the patient. So you use your hand to manually ventilate the patient until you arrive at the hospital when you do the transportation. Okay, and another alarm is I think it's much straightforward. So the first is the low O2 alarm. So if the oxygen cylinder pressure is quite low, it can show this alarm. Means that you need to change another oxygen cylinder. And battery alarm means that the battery is low, you need to recharge it. And another alarm is called no assist alarm. And you can see the color is different. No assist alarm show yellow color, but from above mentioned alarm here show red color. The red color means that this is a first level or high level alarm. So you need to solve the problem immediately. But yellow color means that this is a low to intermediate level of alarm. So sometimes the ventilator can still deliver positive pressure. Okay, so maybe you just turn off it or just check the patient. So this no assist alarm means that when you press this assist button and the ventilator does not sense any trigger from the patient, it will show this no assist alarm. So, but this ventilator can also deliver the tidal breath to the patient by time trigger. So you just turn off this assist, this function, and shift the mode from AC mode to IPPV mode. And the final two things is that the first is extra mode of this ventilator because this is used in ambulance. So they have one mode called CPR mode. But this mode, when you press this button, the screen will change and instruct you how to do chest compression, do 30 times, and the ventilator will automatically deliver 2 breaths. And another extra device is PIF valve, but this is optional. So this is yellow adapter. So they have one-way valve over here. So during inhalation, the ventilator delivers a positive pressure to this. So to the mask, to the endotracheal tube over here, in order to expand alveoli. And this hole is for exhalation. So this part have one-way valve over here. So the patient can exhale from this part but cannot inhale from this exhalation port because they have one-way valve over here. So during exhalation, if the patient is has normal lung, during exhalation, they just decrease the lung size. But if the patient has lung disease or has heart failure or pulmonary fibrosis, during inspiration, the same things, the positive pressure expands the lung. However, during expiration, because now the patient have obstructive disease or pulmonary edema, heart failure, and these things can cause the lung atelectasis or called lung collapse during expiration. And if these things happen, you can see that if you already give the patient 100% of oxygen, FiO₂ is 100%, but the saturation, oxygenation is still low, you need to consider these things. So this is called shunt. Shunt means that no ventilation here, but the patient still have perfusion. And this is refractory. This is called refractory hypoxia, means that they have poor response to the oxygen. So if these things happen, you need to add the pressure during expiration. So this is called PEEP. So this is a spring-loaded PEEP valve. So you connect the PEEP valve to expiratory port, and this size can adjust the PEEP level. Usually it's from 5 to 20 centimeter water, and you can start from 5 and increase to 6 to 8 to 10. And during inhalation, the patient can deliver positive pressure to expand the lung. And because now you have the PEEP valve over here, so the PEEP valve can prevent lung collapse to reinflate the collapse alveoli, to let oxygen can go into this reinflated alveoli. And finally is that when you arrive the hospital, usually in ICU, they already prepare another type of ventilator and connect with the tube with the test lung. So if you confirm that, okay, now press and hold to turn off the device. And step 3 is to close the oxygen cylinder valve. And step 4 is disassemble all the circuit, yellow adapter, auto pipeline, and power cord. And sometimes, because maybe you just use this circuit maybe just 5 minutes, and you have bacterial filter connected, so you can just use the alcohol to cleaning. But if this tubing is too dirty, you need to do cleaning and disinfection. So this is all brief introduction about the ventilator setting and how to use the mode, and finally is disconnect the ventilator and turn off the ventilator. Thank you.